Welcome to this last closing session. So um, we don't know how many times we've had a conference. We will one day know, but it's definitely not 40 times that we've had a conference, but it's probably getting close to about 30 of these conferences that we've had. And we'll keep on doing them. So next year as well, I want to also mention, we run a journal, Journal of African Economies. It's great that we get so many submissions. It's increasing, but it's also great for lots of scholars here. Do feel free to submit. We make a small amount of profit on it, but we use it to bring people to Oxford as visiting fellows, to get African scholars to come also to be here. So it's not all the usual rip-off that someone makes a lot of money on it. We do it all. And I so hope you submit on that. And I also want to mention, and that's largely addressed to those people who have a long-standing link with us, former students. Many of you are here, and it's always great that I see people coming back. From the evening of the 5th of June and the 6th of June, we'll also try to do a pure alumni event for CSAE, former staff, former people, and we're going to go all the way back to some of the founders will be around, and we'll do that in Oxford here. So if you haven't heard about it, remember it. We will formally try to get everybody invited. But of course, in the true way of a center that works on energy, not necessarily always has the perfect systems going 40 years back, we don't have everybody's emails. So anyway, if you don't hear about it, drop a line to us to say, well, we haven't really heard about it, or we know people that haven't, so that we can do and build up our whole. We think that CSE has hosted somewhere in the region of between 150 to 180 PhD students, including many from the continent since it was founded. That's a lot of academics, okay? Many of them are in academia. One of them ends up being a High Commissioner for the UK government. Another one is the Chief Economist of LinkedIn. So they go in all kinds of different places. But many of them, and they keep on being the family. So I just wanted to mention that, so the few things. But basically now the rest is over to this panel. Noam Angrist is the director of the Watwag Hub of Global Education at the Vladnik School of Government here in the University of Oxford, also part of CSE and active with us. He will introduce the rest of his panel. It's over to you, and then I will at some point tell you when it's over. All right, thank you very much.
Great to be here with everyone. I'm really excited about this panel. It's about the science of scale and implementation. I have a few motivating slides, but also just start by introducing. So James Habyarimana, professor at Georgetown, also part of the What Works Hub academic leadership team. Nyathi-Mohohlwane, director of reading in the South Africa Department of Basic Education, formerly deputy director in the research department in the South Africa Department of Basic Education, also on the academic leadership team of the What Works Hub. And Dean Karlan, professor Northwestern, former chief economist USAID, founder IPA, a close friend of the What Works Hub, also for global education. And so yes, great, we're co-hosting this as CSAE and the What Works Hub, and I'll just share a few motivating slides, and then we'll get right into it, some moderated questions, and then we'll open up to the audience. So I'm just going to give an example from education, but we'll broaden out to the theme of scale and implementation. So in education, there's growing recognition that kids are in school. You can see that on the left here. Those are enrollment rates by region. But on the right, you can see flatlining of learning levels. So learning has been really hard to improve, to change. This is something folks are now calling the global learning crisis. The World Bank has called it that, UNESCO. And learning levels are really low. So we know that this is a big challenge. At the same time, there is a lot of evidence and growing evidence on things that actually work to improve learning. And so here you can see the number of impact evaluations in education from various types of efforts and organizations, and it's over 500. So there's lots of evidence on what works. So we have this big problem, but we actually have solutions. And so this motivates, we feel the next frontier here is, how do you take these things that we know work and actually implement them at scale so that they work at a national scale and work in practice? How do we really connect the evidence with implementation and scale so we see real change in the real world? So as the hub, there's three focus areas. One is synthesizing that evidence to make it accessible. One is supporting the use of that evidence, and then doing the implementation science. So as things are scaling, studying it systematically so we can bottle and codify the science of implementation and scale and do it over and over again. We have a really simple framework that we've been using just to motivate some of this, and this draws on some other people's work as well, which is thinking about making this leap from efficacy to effectiveness. So efficacy being controlled, proof of concept, something managed very tightly, well identified, novel, right? This is a lot of the research that's often incentivized, and that's where a lot of evidence sits today. To evidence that's considered effectiveness evidence. So this is evidence that's happening in a setting where you have widespread impact in the real world, and in this case specifically for learning and education. So how do you make that leap? John List has taken to calling this the voltage drop, and others are using that term, that often things can work well at the beginning, and then when you're actually going into the real world and scaling, effects diminish, sometimes totally, sometimes to nothing. So all these things that we thought were promising no longer work. So how do we kind of manage that voltage drop or reverse that voltage drop? So one, and this is actually a framework that's borrowed from implementation science in health, is encouraging more effectiveness trials. And so not just doing efficacy trials, but effectiveness trials that are happening at larger scale, with multiple delivery models in multiple settings, multiple populations, and government implementation. It's a bit messier, but this is the kind of evidence that might lead to evidence that then, when you scale it up, it might work. So different types of evidence there. How do we study the gap between a plan, a high-level plan that a policymaker has made, and then practice at scale? There's a lot of room for friction there within the bureaucracy and in terms of service delivery. And then how to inform policy plans with evidence in the first place. What kind of evidence do policymakers respond to? Is it descriptive or is it causal? Is it local? Is it global? What's their tolerance for uncertainty? How do they trade off effectiveness with cost? Really studying that and understanding that more. And then more connections between these. So this motivates a few specific themes. So one theme is adaptation and generalization. So taking evidence from multiple settings and understanding the generalizability of it, the external validity of it. More adaptive evidence, things like A/B testing or adaptive trials, where you do it across different models and each one you learn in sequence. Studying service delivery and studying the evidence uptake process itself. And then across the framework, just getting more and more measurement. So to get a handle on a lot of these things, just measuring implementation more carefully is really important. Measuring cost is really important. We did a review of impact evaluations in global education, and less than 12% of those studies explicitly measured implementation and reported and accounted for implementation. So something that's mentioned, the mentions of implementation is high, but the explicit quantification of it is often not there. So with that, the ambition is, as things are scaling, to study that scaling process as it happens. So with that, I'm just going to share a final thing here, and then we'll just jump in. So this voltage drop is often this kind of sad, concave, it kind of starts and then it diminishes, the effects diminish. Is it possible to reverse that and actually get more of a convex curve? Can you actually improve over time? If you learn from experience and theory, you might actually be able to improve over time as you scale and go to new settings. Is that possible? Often we don't see that happen, but is that possible? Also, the real world is messy. Maybe it looks a little more like the stock market. You go up, you down, you learn, but as long as the trend is positive, maybe we can get there. So with that, I'm going to ask a few questions of the panel. Do you believe the voltage drop? Do you think that's a real phenomenon? Have you seen empirical evidence to demonstrate that that's the case? And if so, can it be reversed, or how can it be addressed? And maybe we'll start with you, Dean. Yeah.
No, I don't like the question, to be honest, though. It's a little bit like asking, does training work, or do incentives matter? Well, that's a bad one, because I think we all agree they do, but they don't always, is the point. And so it's more about in what context and what reason. Okay.
Yes, yeah.
That is on? You guys can hear me in the back? Okay, cool. Okay, so substantively I have two things to say. One is useful and one is not. I'll start with the less useful observation, which is I think there's there's a correlation between scale and not working, and that's, I think, what gets this. But there's a very simple mechanical reason why about our process is when things don't work in the small, you don't then go and say, oh, well, maybe the problem was we didn't do it at scale enough. So let's do it at scale, okay? And so if you think about a very simple world in which anytime you try something, there's a 50% chance it's going to fail, okay? So you're going to see that half the things you tried at small scale and worked failed at scale, and that's it. So you conclude there's a voltage effect, right? That's not a useful comment, because I wouldn't actually suggest that we go and take a bunch of failed small studies and say, well, let's just try it at scale. Okay, what we should do is say, if the theory was really good on that small thing and it failed, well, let's tinker more and figure out how to make it work. That's how to do it. But that basic trend is, I think, a byproduct of just the nature of the things that move to scale and things that don't. And then my more useful comment is that I can think of things that go both directions. Like sometimes it's going to get bigger, sometimes it's going to get smaller. I have no idea what the average is, but I don't find the average to be a useful question about like what's the average voltage effect and what's the sign on the average. Take cash transfers. Dennis, who's here, I think. Where are you? Somewhere? Dennis Egger, are you here? Left? Okay, was here. But has with others, maybe others from the paper are here. He has work from Kenya showing positive externalities, positive general equilibrium effects. Think about any sort of contagious disease. Go back to like worms, things like this. You have positive externality. That's going to generate a positive voltage effect. So I'm not a fan of the term because I think it sends the wrong signal. But we need to obviously understand how are things going to be different at scale versus not, and we need to study those differences. Sometimes it's administrative about how you manage a workforce. Sometimes it's about the political economy because you're all of a sudden entering into a whole different stratosphere in terms of where the money is going to come from. Sometimes it's about general equilibrium effects through prices. Maybe it's about contagious and externality. So you have to get into the weeds of what that means and then study that. And sometimes it'll be positive and sometimes it'll be negative.
I think I'll build on the design aspect. So it can go either direction, but I'd say it would be about going back to the design. Were you designing for scale? Did you think about what this would look like at scale, who the actors are, inputs, costs, etc.? And I think we don't do enough of the taking things from practice at scale, things that are already happening. They're going to happen with or without you and your research, and thinking how you can tinker on aspects of that and then make it more effective. We had an example of that, a presidential youth employment initiative that was going to happen to us. Because youth unemployment is a big deal, and we could choose to be upset because where's the evidence for this in education? Or we could choose to participate, evaluate, and help them iterate so that by the time they're in the second, third, fourth wave, it works. So I'd say, yeah, learning from scale and building evidence around that, but also thinking when you're working at the design phase, how do you then scale that up? And the final question you had around that, the final point was around credibility. So, well, can you reverse things if they're not working, if the voltage drops? I think you have a serious credibility question that comes into play. If people experience something as working really well and then you scaled it and it flopped with those same people, will they continue trying? And yeah, can you get the fidelity for implementation back if you failed already? I'd have more questions around that.
So the advantage of going last is that you can agree with everything that everybody else has said and not have to say anything. But so I agree that there is a voltage drop. So in that sense, maybe I disagree a little bit with Dean. But I also think that I agree with him that we send the wrong signal. In fact, if we actually sort of emphasize the voltage drop, there are lots of studies that are essentially kind of designed to essentially kind of discover kind of successful strategies, where the dosage that is in some ways essentially kind of being measured is much, much higher than could be possible. And maybe this is Mpumi's point, which is why you're designing for scale. And so I do think that sometimes when you talk about a voltage drop, I think you discourage sort of governments. And I think one concern I have with even the discussion around the voltage drop is over what horizon are we actually sort of talking about a voltage drop? If I think about the South Korean company Hyundai, the first cars they made were horrible. But over time, yeah, sure, there was a lot of export pressure and so on. They become better, and all of this actually was in some ways supervised by government. So I actually think that governments can get better over time, and so maybe this is Dean's point too. But it takes time to kind of put all the resources in place and change the behavior. So Pumi's point, governments are already there are a lot of interests that are already baked into essentially kind of what they do. And many times integrating new ideas actually is just not, so if you look at, government implementation after one cycle and decide, oh, we went from 0.4 standard deviations to 0.05, I'm not sure that, sure, that's a voltage drop, but I'm not sure that's a fair sort of measurement of, in fact, what government can do. And I think we just don't have the horizons to really, and maybe the patience, we're all scholars, we want to publish something, and so if it drops, we move away, or we'll write the paper that says there's a voltage drop. But I actually think that in some ways, I think there is the capacity, and if you're patient enough, you can actually sort of produce, a, maybe not quite go back to 0.4 standard deviations, but 0.01 standard deviation is affecting 3 million kids is pretty good.
So, and we did this study during COVID where we did remote education, and our first treatment effect was 0.12 standard deviation, and that was in a place where we had a lot of infrastructure, we had kind of deep work, and then we replicated it in other countries, and we thought we would experience a drop, and actually the effects kept going up and up. It was kind of amazing. We did 5 RCTs in 5 countries. So the original study was in Botswana, 0.12 standard deviation. Next one was in Kenya. I think we got 0.14, Nepal 0.22, and by the time we got to Uganda, the treatment effect actually went up to 0.89 standard deviations, which was kind of amazing. And this was surprising because it actually wasn't the same organization. It was different organizations, but there were some common lessons that we were learning around fidelity, how to measure implementation fidelity, get better at it. And implementation fidelity was improving across the country. So it was interesting. We weren't expecting this. It was a bit of a surprise, but we saw a bit of a learning curve. And I take the point on the mechanical nature of the voltage drop if you just look at that. So that's interesting. Okay, next question is, so the effectiveness trials, do you feel like that's the right term to think about kind of understanding evidence in the real world? And if so, what are the right study designs? Is it this adaptive testing? Is there another study design, just more evaluation at large scale? Yeah, when you think effectiveness trials, what do you think is the right study design to understand implementation at scale?
So I'll go first now. So that way I get to put my way. No. So I don't know that we should actually kind of have one standard for how you should measure this. So I would say everything. I certainly think that it would be great if we could get governments to be comfortable always testing to improve essentially kind of on their delivery models. I think it would be great if essentially kind of governments did what Google does every day, which is figuring out ways it can improve, or any of the sort of platforms we spend a lot of time on. So that would be great in general. But yes, I certainly think that you have to, delivery is certainly kind of important. I think that's, and I think we want to sort of, a few years ago, delivery was essentially kind of a big thing. In fact, one of the things that got me excited about working in Tanzania a few years ago was that in some ways there were delivery units kind of set up, I think modeled on kind of the UK government sort of structure. And I thought that was essentially kind of really exciting. Of course, as soon as we got the grant, the government changed and they thought, no, we don't need any of those things. People should be doing their jobs. Okay, we don't need to essentially kind of have powerful incentives and powerful political actors essentially kind of supervising things. People have terms of reference; they should be doing their jobs. And so I certainly think we should test in different populations. We should certainly kind of translate as much as we can, sort of subject to the capacities that we have. Many of us work with teachers who really sort of struggle on the content side, and so you want to test different ways to see if in fact the teachers can deliver the materials you want. But I certainly don't think we should kind of restrict ourselves to just one kind of model. So I would say everything that you suggested is something we should do. A/B testing is not sort of straightforward in many contexts. I mean, if you're working on a digital platform, it's pretty easy. If you're working in some other essentially kind of way you can get very rapid feedback, it's pretty easy to do. But if you want to sort of figure out a new curriculum, that might be very hard to A/B test, even though I think that people in the room actually sort of who have a lot of experience. So, I can think about Andy and his work and Claire in Rwanda. And so I think there are ways to essentially kind of do it, even when you have a much longer sort of period.
I'd say from our side, it's the nested RCT approach, where you have multiple RCTs that are testing small tweaks in the site, in the language, in the grades, in even the service provider, so that you're not having a service provider or implementer effect is helpful. But I think what was most instructive for us was an obvious thing of incorporating case study and observational work within the RCT. So once we'd seen the effect size of our first RCT after the first 2 years, it was really good, 0.25 standard deviations of an intervention that worked. But the sobering part was an observation that was done by a qualitative researcher who came back and said, the big thing you've managed to shift is classroom management. So teachers are in large classes, but you've helped them, which is not the core thing, right? We're there for literacy intervention. Classroom management is like step 1 of 10. You just help them organize their learners more, and they're handing out their books a bit more efficiently, and therefore learners are getting a little bit more individualized reading time. That's like the thing you've actually changed. But the amount of time that children are reading with teachers is 10 minutes in a week individually. So that said to us, yeah, the effect size looks positive, but actually we have a very long way to go before we can say this is great and ready and replicable. So I'd say it's making sure that we're learning those micro lessons as we are replicating. And then it's creating enough incentives for ongoing evaluation. So we found that once you've said something works, no one wants to fund the evaluation side anymore. We know now it works. So how do we make sure there's an ongoing evaluation that's embedded in the work?
So, I don't know why this keeps feeling like it's not on, but I should trust it because you were on. I think the part that I struggle with the most on this is the fact that a lot of times in kind of the tinkering with how to do something at scale, if you're running a large government ministry and doing something, and you might be, and let's say you have really good data, so you know something about teacher attendance and school attendance and things like this. There's things that you would find yourself doing that are good uses of the data. There's no randomized trial to it. It's just good observational data. You tinkered with something and you see the blip go up. Or there's some idea that comes forward that seems so obvious and so good that you just implement it, and call that tinkering. And yet what ends up happening is the things that are really obvious to do are the things you don't test. The things that you do test are the things you're not sure of, but those tend to be smaller effects, and so you end up in this weird space where you end up testing the things that are least important, okay? Now, not always. I don't want to be. I'm not like a nihilist. I'm still a researcher. Okay, but you do end up with this problem when you're trying to think rigorously about that tinkering process. Now, I think some of that might come into play when, the equivalent in like the direct mail marketing literature in America. I'll give you an example of like charitable fundraising used to do a lot of work on this, where test out what works and what doesn't. And the question is, what do you suggest to a donor they give? Like, should it be the last gift times 2, the last gift times 3, or should you put the last gift divided by 2, the last gift, or the last gift times 2, if you're going to give them 3 options? Or do you just give them 1 option? So all these different variations. Any one of those tests you could go to sleep thinking about. It's so boring, right? 100 of them is actually interesting, right? But any one test is probably underpowered and uninteresting. And yet, so that's where I think we have this struggle, where a lot of the things that we find ourselves wanting to test might be something where you set up a randomized trial, but if you want a partnership with an academic to do it, the academic goes to sleep at the idea of seeing it done this one little time. And it's probably going to generate a small effect, but you might learn a lot if you can do it 50 times, but not most places can't do it 50. And so you end up in this struggle, I think. I don't have a perfect answer for the way out, but I think this is why we see a lot of the things that we think of as really potentially important when we're sitting around the table, only thinking about how do we solve the implementation problem, is very different conversation from what's interesting here to learn as researchers. And the challenge we need to do is figure out better how to get those Venn diagrams to overlap more. Because we will learn more about the process of scaling if we can document these things. I do think academics play an important role in documenting that process and understanding. But how do you make it so that there's important enough learning coming out of any individual operation that it actually turns into something that everybody here would think of as useful research that furthers careers in an academic way. And that's a struggle. I don't have a perfect answer other than we need more of it. We need more of those kinds of collaborations, and we have to figure out how to figure out a better way of storing the little ones that are individually uninteresting, but in aggregate very interesting.
Reminds me, we do a lot of A/B testing, and we ask the frontline implementers what question they want answered. And part of the reason for that is we want to figure out their priors, and if their priors are kind of not so strong, we use that as a heuristic for that's an interesting question to test, because then the results are informative and they'll inform the frontline decision makers, so they might adopt it. But interestingly, it comes up often where something we'll be interested in testing. So there's a thing we do called an exit ticket at the end of the class, and that tells the teacher if the kids got the objective of the lesson. And so we said we would like to test this, and the teacher said, "Don't touch it. We love it. Don't touch it. This is too important." So it's interesting that was kind of the thing that then we didn't test it because it was too important, but it's the important thing actually. So it's the thing that's interesting to understand.
And then we don't get it documented. Like people should learn that.
Yeah.
That's
Yeah. No, exactly. So Dean, I don't know if people could hear that, but Dean was saying it doesn't get documented, and that's what matters. Great. Okay, so on that, what is a recent study about the science of scale or implementation that is one of your favorites, something you've read recently, or maybe you wrote recently that you think is a really interesting study on the science of scale and implementation?
I haven't written anything interesting in a few years. But I've read a few papers by Noam, Angrist, and Rachel Meager that tell me about the science of it. No, I actually don't think there's a lot, and maybe that is actually the problem. You did give us a heads up about think about this question, and so I was racking my brain. They're not very many, and I think part of the issue is that I think as a community of scholars, this kind of work actually is not very, very, rewarding. It's I think challenging to publish. So well done on publishing your paper. But I think a lot of the documentation that Dean was talking about is not something that I can see many departments and schools actually sort of rewarding. And so I think that is a bit of the challenge. I think that we need a new field and possibly and raise the profile of such kind of work like that.
Noam was also going to say some of your work, but that's been said, so I'll say some of my work. So we've been doing these nested RCTs in South Africa on early grade reading for maybe 13 years now. And yeah, I think what's been interesting about them is, the work, the lessons, and a lot of what we've learned is what doesn't work. So even after learning that, it would be iterating. We've tried 3 different types of coaching, and 2 of them don't work. The very first version we tried is what's still working to date and the iterations. But what's been interesting is seeing it move from sort of the research to implementation guides to 5 provinces out of 9 provinces having that work influence their reading plans. So it's not a paper in an academic journal, but it's seeing that translation from we now know this as a country, and then provinces saying we're going to do this ourselves. So not even with our help. That's been, I think, interesting. And I've always admired the work done by RTI in Kenya, moving from the RCTs to things like what works in a teacher's guide, page length of a teacher's guide, what makes teacher training successful, how much interaction, how much lecturing, how much you do, I do, all of that. Not interesting in the academic way, maybe some of what you're saying, but super helpful for us as we design things and don't have to learn the lessons they've already learned. So, yeah.
Okay, so I too was going to name Angrist and Meager, but I'll skip. But I think when this question was asked, I took it to be I'm supposed to name um, research from other people. No offense, I don't mean, which is very different. I've learned from when you're asked about who your favorite children are. Then you're supposed to name your own. So that's important to remember which one you do. Which one? Yeah, I got this straight. Um, the so there's two psychologists. Well, one's a psychologist and one is best described as eclectic. Not Rachel. I'm sorry, Angela Duckworth and Katie Milkman at University of Pennsylvania, and they set up a series of projects under this umbrella called Behavior Change for Good that I think is a really exciting model. It has its limitations, just like anything, but they've done one in education that I'm not involved in, so I'm naming that one. I've done. And it's with community schools in America, but this could be done in South Africa, anywhere. And what it's doing is they form the partnership at the high level with an implementer who is at scale already. It was a pharmacy that works throughout all of America. It was a gym network all across America. It was these community schools, community colleges across America. And then they open up to a series of researchers and they say, look, here's how it's going to work. We do all the work on the data. We have these outcome areas. Your goal is to increase the likelihood that students finish school, that they graduate, or that they finish this year, or that they go to the gym, or that they get their vaccine, whatever the case is. But we're going to organize all that. We're going to organize all the data use agreements, everything like that. We just want your creative energy. We have 10 million observations that there will be. So, we've done the power calculations. Everybody can have 250,000 observations. You propose things, then they have a little committee that decides what passes through, and it's a very structured process. And, you can learn a lot about everything and how it's performing compared to other things. Now, you end up with a little bit less theoretically driven tests. It's a little bit more of a horse race, but my gosh, it is a nice starting point to at least establish some basic ideas and see what's working, and then second generation work could dig in more about the theory as to why things are working. So I think it's a really neat process of testing things at that level of scale and yet still embracing the creative energy of professors. So it's an interesting model, and it would be great to see that take place in some developing country context too.
Okay, now another question, which is about your own work. What is a piece of evidence you've produced that you've seen scale, and can you tell us about what happened, what worked, what didn't work, if there's evidence you've been involved in that has scaled? So, Dean, do you want to start? We'll go reverse order. Yeah.
So the answer for me is there's a model of social protection that people refer to as the graduation model. Given the topic of today, just to be clear, it's not about education. It is a social protection model, which is a multifaceted approach, usually a cash grant along with training and coaching and savings and things. But it's and I actually got involved reluctantly initially. It was one phone call. I just went from reluctant to enthusiastic in the phone call, but to be clear. But I was reluctant at first because it was so involved in so many pieces that I was concerned that that of course it's going to lead to a positive effect. And I'm not sure what to do with the magnitude exactly, but it was, kind of. And the second concern was that it was doing so many things that the question was like, what are we, like I was thinking like the typical annoying economist of what's the mechanism, and like when you're doing all these things at once, how are we going to figure out like why it's working, right? Where I got excited about it in that very phone call was when the conversation turned to not just doing it once, but doing it 6 times or 7 times across the world all at the same time. And that's kind of what turned me on initially, because that was one of my pet peeves, has always been one of my pet peeves, is we don't see enough kind of a multi-site kind of context where we get to test our theories in one place simultaneously in another with a similar enough structure. So since that work, we've now seen this program did actually produce genuinely good results, and we've now seen it move into many government social protection programs, where there's been now, by last count, something around 80 million or 100 million households that are now part of this program. in various parts of the world. I think the number might actually be bigger. It gets into a little of a definitional issue where there's some that will claim a much bigger number and some will be conservative about what they call it. But there's a group, I'm not sure if it's still here, but I know there was some work presented here that was orchestrated by Partnership for Economic Inclusion, which is a group at the World Bank that got kind of built around scaling and bringing this into government programs. So, and the how is like, was that part or was that the second part? You wrote that? Okay. The how, I think in a sense it's a very simple but hand wavy answer, which is it does not, it comes from involving policy people from the very beginning and building relationships. Like it's not, you don't just you don't just do research, write a paper, go to some conferences, present it, and then think the world's going to change. That's just not how it happens. These were organized, those original 6 that were organized by, Ford Foundation along with CGAP, which is an arm of the World Bank. And from the very beginning, there were meetings where you had, ministers of social protection coming to, observing what was happening along the way. And that was key for seeing it take off so that it wasn't just some academic exercise happening on the side. But it is building those relationships and engaging in those policy conversations and having that part of it from the very beginning. Which is
a quick follow-up, and this will be for everyone. What's something that stayed very similar from the original evidence, and as it scaled remained similar, and that was important, and what's something that changed as it scaled?
in that program?
Yeah.
I don't think that we are in the middle of doing a meta-analysis of it. There's now been something in the ballpark of 50 to 60 randomized trials. I'm pretty sure we do not see any. I'm going to look and see if this is right. I think I looked a long time ago and we saw no correlation between size of program and treatment effects. But keep in mind that that's a very messy comparison. So I would say that we have seen some scale at governments with big treatment effects. I think the thing that is most consistent is the. So I'll tell you here's the joke I used to tell about it, which is the original paper had 6 countries and 9 co-authors because the different countries had a slight different combination of people involved in each of the sites. And people always used to, and there was the average effect was really big, really good, passed muster, that's why it moved into policy. The variance was very much there, right? There were some countries that worked much better than others. So I always got to ask questions, well, tell me more about why it's working better why did it work so well in India and Ethiopia and not so well in these other countries? And my answer was always that the first rule of any meta-analysis is thou shalt have more co-authors. I'm sorry, I said it backwards. Thou shalt have more observations than co-authors. Okay, because we had 6 observations. You wanted me to start telling you why it's working differently in these 6 sites. I have 6 point estimates and 9 co-authors, right? We still have that same problem, even though it's now been 50. I don't have, there is no clear answer coming out of the meta-analysis that says you must have this component. Every time there's some result that I think is strong or some with insight, I can show you a counterexample of another one that said, nope, we actually implemented this at scale and did really well without even adding cash transfers. So it's not to say I'm nihilistic, like there's nothing we're learning from it, but one thing that we're learning is that iteration is going to need to take place context by context to figure out what is the right thing to do. There's some core ideas that can translate and that can move into policy, but the best policy is then to also build an evidence team within the Ministry of Social Protection to help them continuously learn.
So I think the first thing has been, you said what scaled. It's been about defining scale or redefining scale. I think when we started with our work, we thought you do the research, you present it to a ministry person, you give them a policy brief, lol, and then they implement. In reality, it's not that. It's non-linear, it takes forever, it's multiple iterations. Your study is but a contribution to hopefully many studies that prove the same thing, and to many factors that lead to change in policy. So I think those are the big lessons we've learned, but maybe I'll speak I spoke about the early grade reading study, but I'll speak about a spin-off that came from that. Because we collected years and years of early grade reading data in African languages, we early on identified a gap in measuring oral reading fluency in African languages. It's something that's seen as important in early reading, particularly in a context like ours, where 80% of children aren't reaching international benchmarks. You definitely want to know what's happening in those earlier skills. So we identified that early on, and because we had this data that we could reanalyze that we owned, we were able to create reading benchmarks for 11 languages, and they're each language specific. For some, we could repurpose data. For others, we could convince other data collectors to top up what they were doing in support of our work. And then in other third category, we collected data specifically for those benchmarks. And we now have had the first national survey that's measured against these benchmarks. So for the first time, we know how many grade ones can read their letters, grade twos by language benchmarks. Other unintended aspects that have been part of the scaling is that these benchmarks now inform the curriculum. They're written into the current curriculum revision, so teachers know that these are the benchmarks they're working towards. They've been communicated to all publishers. These are the textbooks the state is willing to buy. They need to align to getting people on these benchmarks. What made that work is long patience and being able to focus on reading for 15 years, I guess. It was getting internal people hired and working for the state who can do this work as part of their ordinary jobs. So we don't have academic incentives, it's just the job. And even with the influence part, it's helped because we need to influence curriculum who are the implementers. And even if they reject the work initially or have some reservations, we all are employed by the state together. So we'll see them next month and next month and next month until it all comes together. So that responsibility and accountability within the same organization helped. And the final thing has been extending beyond doing research. So one of my colleagues here at Lesang sits in the curriculum meetings and writes the benchmarks into the curriculum documents. We don't give it to them and say, good luck writing them into the curriculum, because we understand how they're created, why they were done, when you should do them, all of those things that are not curriculum's competence, they are things we've learned. So it's going beyond the research, actually.
So I don't have as great a set of stories to tell, but let me talk about some work that I think kind of scaled, sort of. So I don't know, maybe 15 years ago, did some work in Kenya on with minibuses and put stickers. We found 2,000 buses to put stickers in, and found another control group and found a pretty large reduction in accidents. And like Mpumi said, yeah, exactly. It was actually surprising. The first time I saw the results, I thought there must be a mistake. It was large. Exactly. So then we go to the insurance company. The big insurance company says, "You could make a lot of money doing this. Here's what we've done." And the CEO looks at us and says, "My biggest problem is the corrupt police. Do you have anything that can actually help me essentially kind of reduce the fraud, because I'm paying out essentially kind of all these fraudulent claims?" And we said, no, this is really here's a really important study. You could, reduce your essentially kind of claims by a great deal, and especially including fatalities too. And his brother calls him in the middle of the meeting, and he says, these guys here, I have some guys here telling me about a study. They think that essentially kind of putting stickers in a vehicle can actually reduce. And his brother says, "That's an excellent idea." And he turns around to me and says, let's do this together. But he's a pretty absent-minded CEO, so he's not the guy who actually sort of is in charge of the details. His deputy CEO is the kind of the person who really manages this. And Dean said about building relationships. She was much harder to essentially kind of be friendly with, except that she was a chain smoker. So every single time we flew to Nairobi, we carried a lot of cigarettes. And then she allowed, and so I think we did maybe an effectiveness study, because then we said, the next round, we're going to work with the vehicles in the insurance company, and we're going to add lots of different arms. We're going to test different messages. We're going to also test, we had a placebo problem. And so now we had 20,000 vehicles to actually sort of test. And the cigarettes certainly helped us. But we didn't have, of course, the high dosage. When we do the study, we put the stickers in the buses. When the insurance company sort of sells you insurance sticker, they just give the driver essentially kind of the sticker without stickers. So the driver can just put the stuff in the shelves. And it was very clear that in some ways there was a voltage drop. The dosage dropped. Not every driver was putting the thing up there. We had a little lottery and so on to try and incentivize it, and it did produce effects. The effects fell by a third. But then we decided, okay, this is great. We proved working with you that in fact this thing works. Here's your data. You can see it. And they weren't that interested. No, there was a little wrinkle. There's a little cartel in Kenyan insurance which says that they are not allowed to essentially kind of charge a different price for. And so we thought, if people put the stickers up, someone reduce the price of what they pay for the claims. They say no. They couldn't do that. But then we went to the government and said, here's a great idea. Every vehicle has to be inspected at least once. Every vehicle goes through essentially kind of these inspections. Use this opportunity to give put stickers. Only insist, make it a regulation. Government was like, no, it's politically too costly. It had taken us actually a long time to persuade owners to put stickers in their cars. Anyway, so we decided we're going to do it ourselves. We worked with this insurance company and put stickers in, 65,000 vehicles until the money ran out. But ultimately, in some ways, I should say, so we went from 3,000 to 65,000. I would say close to about 80% of the minibus traffic in Kenya. But nobody was willing to essentially kind of pay for this, kind of in the long run. So I don't want to say it's a kind of scaling. I think it was we got some scale over some period of time.
Yeah, that's scaling. I mean, do you know if it worked at scale? Do you have any evidence on?
Do we have any evidence if it worked at scale? No. Because we spent all the money, essentially kind of we spent all the money. We were convinced that this was going to be great. So in fact, so we got money to actually sort of measure scale. And in fact, GiveWell did give us some money to do this. But in some ways, we were interested in actually sort of testing this in other countries. And so we spent most of the money in Tanzania and Uganda trying to do the same thing, and found pretty precise zeros. So. No. So this is clearly not an intervention that travels well. In Tanzania, the buses were too big. So in some ways, this works well if, in fact, the passenger and the driver are pretty close to each other. In Uganda, we made a very, very terrible mistake of putting stickers in different languages in the bus, and so it didn't really work very well. Everybody who can read, would have been better off putting them in English, to be honest. We try to be very clever, and so anyway, so we have some reasons to think that why we have. I think we understand why we got zeros there in both of those places. But that's where we invested a lot of the measurement, and much of that actually was in chasing around police records and transcribing them. In many of these places, the data that you need to actually sort of track the success of these outcomes is actually sort of really, really poor. And we made big investments there, but unfortunately got a bunch of zeros.
Though maybe if you tested it back in the original site, then maybe. So last question for me, then I'll open up to the audience. Academic papers have a very rigid structure. Do you think there's anything that could be tweaked in the academic structure or paper, that would facilitate more inclusion of information that's relevant for the science of scale or science of implementation?
Yeah, so in some journals, as you publish, they ask you to share your data and a data user guide, I guess, explain your variables, etc. If we did something as simple as that, but for implementation, so we agree on whatever the minimums of implementation are, dosage, profile, duration of the intervention, etc. But more details than we mentioned the word implementation, like you said, and make it compulsory. If you want your paper published in these journals, you need both the data guide and the implementation guide. Might be a good enough incentive.
Yeah, I think so. It just doesn't fit for all papers, to be clear, because there's a lot of randomized trials that are where there's an intervention involved in some way, but it's not a program evaluation per se. But and I think this is the one of the biggest tensions that exists. So I'll give you an example of one and where I think is needed. But okay, first, actually, let me do this in reverse order. The short answer is yes. I think we need what I would call an implementation appendix that details all the things that are not worthy of the paper. Okay, but here's an example of what I mean by that is I'll go back to the graduation space. We just published a paper that took 3 different sites that tested out doing that model of social protection with either as a group process where people came together in the community, and then there was a group and a coaching process that took place in a group versus individual house by house, household to household. Right? I can make both of those sound like they seem better than the other. You know, a group, you learn from each other, you gain some social camaraderie, you build social capital, you have some social discipline, and you hear about each other's issues that might actually inform you about how to deal with yours. On the other hand, house to house, person to person, the agent gets privacy, gets to hear customized, more tailored to your specific issues. Maybe there's issues you don't want to share with others, and you get that more one-on-one interaction, right? So it can go both ways. We've had 3 different sites on that. Some of the people in this room are co-authors on some of them. See Stefan, sure, Rocco, where are you? We find if you didn't know any better and I showed you the results on those tests, you would tell me, you would think I was showing you the orthogonality tests from the baseline. Okay, they were spot on across all 3 sites, and that's so we read this paper. The paper talks about group versus individual coaching and kind of goes into a little more detail about what I just said and the pros and the cons and the trade-offs, goes into some of the process data that we can speak to about what we're seeing. At no time does it talk about how the transfer size amount was chosen for the lump sum cash transfer. At no time does it talk about what was the savings vehicle and how was it chosen in that site among all the other choices. Why? Because the paper was about group versus individual coaching and that aspect of the program, and that's why we wrote the paper. So if someone were to pick up that paper and want to run that program, they would have no clue how to do that. So it would be great to have, in this case, there's other resources to try to turn them to, but the point is there would be nothing in the appendix that talks about all of the implementation decisions that were made in the program that were not deemed interesting as part of the research question, but yet were decisions made in the design of those programs. And that's the mindset of the implementation program. It shouldn't, frankly, be written by the academic. It should be written by the implementer as they're, and ideally up front, as they're making decisions, having a log of all the decisions they're making in the meeting and the agenda, and someone, I mean, the ideal world is you have like a meeting log, and then now you stick it into Claude, and then you can say, pull out the interesting things from here and make it into a plan, and tell me all the decisions that were made in the design of this program. That would be really nice to have. Put them online, don't make it part of the whole refereeing process. Put it online though, and make that a resource so that someone else who wants to pick up what you're doing can see the bigger picture of all the things that went into your study that were not the academic part, but yet were necessary.
And that's something that you've tried or are trying?
I am trying it with you, Noam.
Yes.
So, we have a paper in which we're trying a prototype of it.
Yeah, great.
I
So
was trying to be subtle. I'm not very good at being subtle.
yeah, so I agree with both my, I guess, distinguished panelists that we should certainly have a section, or at least there should be a write-up of implementation. I'm not sure it should be written by the implementer. I mean, they're already doing enough work just to such kind of do the thing. I actually think that this should be written by scholars, but I'm not sure that it should be written by people like us. I actually think that there are disciplines that are essentially kind of pretty good at observing essentially kind of different context. And I think those would be essentially kind of the right people to So, but I think there's kind of 2 kinds of implementation kind of write-ups. One is essentially kind of, what did we do, kind of the step-by-step. I think the other for me is the second sort of phase that Dean referred to. He said, why did we do this and not that? Why did we use community health workers to do this thing and not essentially kind of the social worker or whatever it is? And I think that in some ways is the part that where the analytical piece that I think kind of is really important in helping not just the kind of the scholarly audience, but in fact other implementers. I think the biggest, I think I was having this conversation earlier with you. One of the biggest challenges of any kind of government person deciding to adopt something is just the risk they think about. Sort of, I'm going to do this. I'm going to raise money. I'm going to burn a lot of political capital, and a lot of things can go wrong. And they only think about all of the things that can go wrong. And I really think that a piece that can help in some ways reduce essentially kind of the variance of what they think kind of the potential outcomes are likely to be could actually be very useful in actually sort of making it a little bit easier for people to adopt. And I think, I don't know, an anthropologist would be a much better sort of author of this work than we. Or I, anyway.
Great. So we'll open up now for questions from the audience. I think there's mics around. Yeah, so we'll take a few at a time and then we'll bring back to the panel. So yeah, just raise your hand if you want to ask a question.
So there's this conjecture, right, that that the reason that the treatment effects are small is because they're going to do the obvious things anyway, right? And so we're only going to test the little kind of trivial things. But why aren't the obvious things already being done, right? Like, this is not super clear to me. Is it that there's like an injection of money or,
Let's take a couple more. Yeah.
Thank you. Thank you for very useful exchange. Yes, I'm hanging down with the World Bank. So my question is that if we look at like a different fields, right? Say for example, education, labor, social protection, and let us say political science, right? So I just wonder, let us say in political science, perhaps many times we see policy that were implemented nationwide, right? Without even trial, without even scaling, right? So I just wonder, is there anything that we can learn, from the other topics, from other fields, so that in terms of scaling, it can be something like a building, something like a more useful. Yeah, thank you.
Yeah, thanks. We were talking about, coming also to Jason's questions about the obvious, and I think maybe 2 years ago, indeed, we could all do all the obvious things, but we're also, as we all know, in a different context at this point in time. Maybe there are no longer all the resources to do all the obvious things, which makes it all the more important and possibly also under unfortunate circumstances possible to test like what kind of obvious things are really necessary. Would be great to hear a little bit more about that as well.
Great. Okay, maybe one or two more. Yeah.
And so building on that, given the situation with funding for research, testing at scale is likely to mean more reliance on administrative data rather than dedicated data collection. What's your sense of the direction and travel in terms of the quality and availability of that kind of data?
Great. Okay, maybe we can start with those. So pick a question that spoke to you. You don't have to answer each one that really you want to tackle.
Okay. I'll start with the quality of administrative data. My sense is that it's improving over time, but often improving based on feedback that the data generators, collectors, etc., in the ministry get. Because often they're collecting tons and tons of data, and their sense is often as the EMIS officials that it never gets used. Someone somewhere a long time ago decided it needs to be collected, but we're using 25% of it. So they have no incentive to correct it, etc. What we've seen is a partnership with a university that looks at different modules, and every year they've increased the data they review and then have closed meetings where they give feedback to the national department to say in these 5 fields, this is incomplete, this is how it could be strengthened, this is why we need it, etc. And over time, I've seen iterations where that data quality just gets better. And I think even internally as the ministry, the research section doesn't use the administrative data enough anyway. And so doesn't create an internal incentive for better data. So whenever those conversations are robust, ongoing, detailed, with a clear use case, I've seen the data improving over time.
Yeah, so I maybe a small footnote to this. in some countries, the administrative data is actually sort of very politicized, and so I actually don't think you can use it in these ways. But yes, I do think, and maybe to Thomas's sort of question, much of the scaling research, we didn't talk about ed labs and embedding with government, but in fact, I think a lot of the resources that we're going to be using going forward, in fact, are going to be resources generated by government. And I think one of the good things with actually sort of doing a kind of measuring alongside government is that, I think you build essentially kind of a credible case with the people, in fact, who need to make the decisions early on. But ultimately, in fact, I think you are essentially kind of testing models that, in fact, they can deliver, as opposed to essentially kind of the Rolls Royce that you can generate. And so I do think that that's kind of that is going to be the model. We won't have the FCDO money to essentially kind of do interesting things. We'll have to essentially kind of go to the government of Tanzania and say, here's something you can test.
So I'll touch on two of these briefly. Why aren't obvious things already done? Well, sometimes, I mean, what I mean by that, at least when I said that, is, not something that is like something where you get feedback from a process. Like, so something being rolled out, and then you do some qualitative work, some focus groups, you get feedback, and that feedback is just loud and clear and obvious. And so then, make the change. That's more of what I meant. But it's, I mean, I'm sure there are some things where one could say that should have been obvious up front had you thought more about it or something in the design, but like it didn't happen, and for whatever reason. That the data, I think there's two different contexts. There's admin data and there's kind of remote sensing data that we're seeing, the world change a lot in, and so we're seeing, much longer but narrower data sets is the way I think about it, in the sense of, huge N, but less rich in all the information that you might get. Maybe a little bit less measurement error because of the administrative nature of what it's being captured, but no qualitative questions, no, mental health is hard to track, things like this. And I think it's going to change the way we do a lot of research. There's going to be a lot more research that is easier to do at scale at lower budgets, where you then are left with a struggle of answering the why question, because a lot of times it's the width, the length, the length of the data gets you small standard errors, and the width of this data gets you the why. Is one way, a very simplistic way of thinking about it. It's that richness that helps you understand why something is playing out. There's exceptions to that. I don't want to be overly simplistic, but I think that's so. We're going to just need to see more research to help understand when administrative data is useful in that way. I'll give you an example of something that was great for one thing and horrible for the next. Right. So in Togo, I think Togo gets the ribbon for being the first cash transfer program during COVID. They rolled it out like crazy fast because they had a database of, from a recent election, of people who were recorded as informal workers. They declared informal workers correctly as a good target for poor in the urban context of Lome. And so they rolled it out to anybody who had previously registered and declared themselves an informal worker. Right? And there's no knowledge that that would lead to a cash transfer. So then they wanted to go into rural areas, no such registry there, in the way it worked out. But they had a collaboration with the two cell phone companies, and then people on our team, not me to be clear, co-authors, who basically got cell phone data and used it to validate from old survey data of just a few years ago that it could be used to correctly target poverty. And it did a really good job. The cell phone data was really good, knowing where you ping and how often you ping and how often you move and how often you call and text, and basically all the data that come through, not the content of the text, just to be clear. But all of that was really good at targeting poverty. And so it was then used to roll out the next wave of cash transfers in a rural area. That was done under a randomized trial. And then we used the cell phone data again to measure the impact of the cash transfer program. And it did a horrible job at that. It did not pick up the changes that we did observe when we did a survey. And so you gotta, so it's really long, very simple in a sense, administrative like data, was really good at picking up kind of long-term static measures of poverty, long-term status, but really bad at picking up food security. that was happening in a short run status.
I think one theme that's emerging, and I agree with the resources changing for research. There's a bit less. Yeah, I think an interesting theme is how to understand the data that's there and if it's credible, if it's valid, how we can use it better, rather than bringing in kind of lots of ad hoc new boutique surveys. So that feels like a really interesting area of kind of what's the data that's there, understanding if it's credible, using it more. We were trying to measure learning remotely, and that was controversial because that hasn't been done as much, but it was much cheaper to do through high frequency phone surveys. And then we validated it. We did an in-person assessment relative to phone. Sometimes it works, sometimes it doesn't, but trying to think about cheaper ways to measure or leveraging the data that's there, but then adding validation, not just taking it at face value. Okay, another round of questions or comments?
So I have a question about how education interventions are sustained over change in political administrations. And just thinking through the challenges of institutionalization and how sometimes interventions are on a pathway to scale. What are some of the challenges that stop that from actually reaching full scale? I know that often if there's acceptability at the front line with your school leaders, it'll carry on anyway. But what happens at the top level when there's a change in administration, there's no longer an appetite for taking a well-evidenced policy intervention to scale? How do you see this? What are the ways in which we can mitigate what I think often happens anyway? But is it something that you agree is a challenge, and how do you think about it, especially in DBE, if that's you're already embedded in your research unit? Is there a friction that you see there? And then with other colleagues that are working closely, I can hear Asanda laughing, so maybe it's a yes. And then with colleagues that are working closely with government, how do you work through this challenge?
Great. Let's take a couple more.
Can I just answer that one? I'm just
Sure,
so
yeah,
glad the United States does not have to worry about politics getting in the way of policy. So that I'm going to leave this for other country people.
It's a bit of a related question as a political economist, and just going back on the science of implementation and science of scale. And my question was on, it's almost as if during this conversation, scale was a given. Once you pilot, it's effective, we're going to scale. So my question was, is there any literature coming up about the barriers towards scale? And is there a science towards navigating these barriers? And also which contexts are more likely to accept scalability and which contexts are not? And perhaps does that spill over to the voltage drop that we're noticing if there's a reluctance, but there's this external pressure to scale? So I'm just wondering if there's any, literature or science being conducted on, the decision to scale or not.
Thanks. Very interesting. Peter Serneels. So it's basically related to the last question, whether you can give or give a bit more insight on where you see the boundaries between replication and scale. Just like scale-up was totally undervalued years ago, I think replication is still enormously undervalued, and there's no incentives. Many of the problems are similar. In work on malaria in Nigeria, we find that on the same site, doing it 3 years in a row, different factors matter. So the health field is far ahead. How do you see that tension? And how can you break this chicken and egg problem? When you replicate, you find out that things matter that you didn't observe before. But how can we anticipate this? Because our theory is so focusing on one coefficient that it often doesn't inform us.
One more, yeah.
I have it. Hi, Vincent Somville from the Norwegian School of Economics. There is one way to approach the scaling problem, which is like very classic, to just think about a macro model of how it's supposed to work at scale and then use the RCTs to estimate the key parameters. That one you have not discussed at all. So I was curious about why not take that approach? Is it that the models we have are not adequate because they don't take into account what you think matters in the scaling up, like implementation or other issues? Or is it, what are your views on that approach?
Okay, great. So I think we'll bring back to the panel. Yeah.
So I think most of the questions were for other people, but let me say my little piece, and then I'll hand over the floor to Mpumi. So, and I think Han had asked a question a little bit earlier about the political process in general, and the political process is really, really important, because I think the energy to even do anything well and to sustain the support and resources for anything really comes from, in many of the places I work anyway, from essentially kind of the most powerful offices. And those folks are essentially kind of concerned about, the army is really important as an agency. They make sure things get done very well there. They for other things, in some ways, they're happy to have a big announcements, but not essentially kind of do a lot of implementation. And so I actually being careful about and being, I guess, aware of essentially kind of the political cycle is quite important. Yaquebis, Andy, and I actually been working in Tanzania for some time. And one of the advisor of the president basically made it very clear to us and said, we have 2 terms. In the first term, we basically sort of try and preserve our political capital. In the second term, that's when essentially kind of we do interesting things. So if you have any interesting ideas, don't come to me in my first term. It's too risky. When I don't have, so that's I think, understanding, knowing your client, or knowing essentially kind of the government and the context, super important. And of course, as you rightly point out, things change. The biggest change that always happens is that, the 2 or 3 champions that you're working with very closely to do something will very quickly go somewhere else. And so you kind of have to rebuild, and so try and build some insurance, and maybe essentially kind of engage with 10 people, because essentially kind of in some ways you want to actually sort of have people who you can actually work with. But it is very challenging in some way, and I think this goes back to the point of, you almost have to be willing to be around for a long time. And unfortunately, I don't think in our field, that kind of investment is going to be essentially kind of rewarded in general. Replication, I wish there was as an outlet for such kind of papers. I'd like to replicate, the 2 papers I talk about in Tanzania and Uganda, where we try to replicate some work in Kenya. That's still languishing in a desk somewhere, because it's just very, very hard to publish nulls, first of all. And so yeah, no, we have a long way to go, I think, and it would be great if we could all essentially kind of coordinate on agreeing to say, we should replicate more. And yeah, but I do see a distinction between replication and scale in some ways, because I do think the questions you're trying to answer can be a little bit different, but in some respects it looks, I guess the scaling questions look like some version of replication.
So two thoughts, one on replication and one combining 2 questions. On replication, I think one thing to remember is there's no such thing. Well, okay, I take that back. Once you invent a time machine, then we can do it. But until then, there's really no such thing. So what we really mean by it, and I'm not, that's not a criticism. I'm just saying, like, time is a different year, in same place, same location, time, different conditions, different world. So what we really mean by replication is as few changes as possible, or knowable changes as possible, on context matters that we think, based on our theory, don't matter. But that's what we're trying to find out, is, do they matter? Right? There's a reason why we think there's a need for that, but if we were physicists or chemists, we would sit in a lab and, in 9.8, I'm not a physicist, but, 9.8 times something is a speed. Like, you don't see that. That's done now for school children so they can measure things. You don't see physicists challenging that question anymore about some basic physics laws, right? It's known. But in social science, we know that there's just so many factors that affect the world that we feel there's more of a need for replication. Even if you've seen something 10 times, there's still a question of, like, well, what about over here? What about over there? And so there's still that need for it. There is a journal which actually encourages replications, and we sent, it doesn't define well what it means by replication. Does it mean the theory is being tested, applied? So we actually submitted a paper that we thought was a replication of a theory, and we submitted it, and the referees came back and said, "Oh, this isn't really a replication, because the first paper was about hepatitis, and now it's about COVID, and so that's so different. And the first paper was Pakistan, and the second paper is Zambia, and that's so different." So they said that doesn't count as replication. So we submitted it to a different journal where we got, of course, replicated for being too much of a replication. I kid you not, I'm really not kidding. I should probably put these ref reports up on the website or something. And so we don't deal well with this. That's all. I'm going to close by just saying that we do not have a good relationship with this concept in economics. We need a better one. Because it is important, but it is about defining the context and what matters and why, and then testing those kinds of changes. I will say one more thing. It is my favorite personal paper. It's called Blue Porches, and it does test the replication of the concept of the endowment effect. And it was done with Halloween in school children, with their son up there was part of it. And it's great, and it only has one site. So if anybody ever wants a site about external validity of a concept, go for it. It's my, it's the entire paper is 3 pages long, but you don't even need to read the middle part. It's just the beginning and the end. And we did not replicate the endowment effect for using candy in Halloween. We tried replicating it, it failed. I think to the LSC question, I see very similar. I'm sorry, I remember who asked it, but I heard you say. I couldn't see. Oh, there you are. Okay. Very similar to the science of scale and understanding what are those things. And I think what are the parameters that you need to know. So it's one thing to just take the micro scale RCT and then stick it into a macro model. But unless you have estimates of the parameters that are very much about that scaling, and so that's why I see this as a very connected question to the question from over here, because it's about having some theory about what is different about the scale. Is it an externality? Is it a contagion effect? Is it a labor issue? Are you moving prices? What is it that's changing? And so, yeah, you need that is exactly the right way to think about it, is take a micro studies, get parameters out of that, and have a macro model. But the problem with that, is, at least in my experience, is that I've never seen a situation where you got 10 macroeconomists into a room and they walked out with an agreement. So I don't know which model to use, and I guess that's a call for research to help understand and help put those things to the kind of a sharper test. But you can use many different models and make very different predictions out of that process. So I said that in a negative way, but I actually mean that in an encouraging way, that we need more of that. We need more of that exact kind of work to then understand what are we going to get when we do it at scale, because there might be things that you just fundamentally cannot randomize at scale, and that's exactly what you do. So cash transfers is the example that is top of mind, where I've been involved in conversations on this space, where the goal is to do it for the whole country, and then that's fine, but you can't randomize at that point. So how can you use the micro experiments on cash transfers to then understand what is the likely macro level effect? And you can even use like local macro, like the Egger paper is best described as a local macro experiment, right? It wasn't the country as a whole, but it did give you these estimates, which can be used to then estimate a broader model.
So
We're asking you to talk about your bosses, Nompume. That's risky.
is this live stream? As long as it won't be on the internet afterwards. So the common
It is
thing.
live streamed, I think.
Yeah, I remember. I'll be careful. I think the common thing that academics can get told and spend a little bit of time thinking about is the elevator pitch. If you were with the minister is tired. She doesn't want to hear those 1,000 ideas, because everybody's pitching to the minister, right? So it's, for me, there's a risk with pitching ideas to the minister. You're making them political. And often the minister is not the administrative head. They don't control the budget. And they really do get oversubscribed with ideas. And so the next level would be speaking to the director general or the head of department who's administrative, who is the head of the budget, who tends to be there for much longer than the minister, who knows the stuff and actually makes decisions. So I'd say that's something that's helped, or that I'd recommend. But even further than that, the DG also has their own financial responsibilities and strategic work they're doing. They're not the program manager, much lower in the circle, in the pyramid, you would probably not know them. That's the person who controls their own budget, who writes the actual curriculum and makes sure it gets implemented. So it's sort of knowing when you want your things to be political, administrative versus actually this is the program person. And yeah, I think we miss the opportunity to speak to the right person. And I mean, being internal helps with my job, and the job of the research team I work with is not dependent on who the minister is. And it is to our interest to not make it too much of what the minister's interested in, but to get internal buy-in about why this works, how this works, so that it can withstand change. And then there is a timing issue about what you release and when you release it. We've had times when we have been told to not release some reports. And there have been times when we've chosen to not release some reports. And because those reports could be used either way, we could release a report that has 60-40 good and bad things. The media that's for the upcoming minister could say, look at how terrible this previous minister is. The current minister could also say, or others could say, we're using it as an election campaign for this minister. We can wait 3 months until the election cycle is finished and then release that report. So to try and depoliticize what we're doing. What we did that was interesting with the current minister, because for the first time we have the previous opposition party is now we have a new government that's not just one dominant party. And we have a minister who used to be in the opposition. And it was having the conversation up front to say, we're going to do this national survey for the first time. You're probably going to get slammed because children can't read. Even though we're going to do this for the first time, we already know from other data sets. So we're anticipating what the results are going to be. And we want to credit the previous minister under whom we've done these 5 years of work, but we're releasing it through you. And what do you feel about that? And having that chat up front, and then getting their feedback, their buy-in. So however that played out in the media was fine, because we've had the conversation before. And she agreed that we should acknowledge the previous minister. There isn't this artificial separation in education where you come in and you change everything the next day. So thankfully we've had that stability. We've also found that having other voices that speak into the space helps. So provinces are decentralized and semi-autonomous, and they are increasingly becoming stronger and making their own decisions, including critiquing us as the department for work we don't do. So we've done a national survey, we don't give them the data. They've now, in some provinces, decided they'll do their own surveys because they want to monitor their own progress. So that's a new development that helps. So if you get a province that's committed, they can do this multiple times without needing the central to hold. We also have found people like the National Treasury or the presidency, they're not in the department, they're all government, but we're actually different players in government. And if they have a consistent message with what you have, then it holds. And then even the international platforms, that work we're doing gets recognized and is seen as credible, means something. There is that sort of, if they're seeing it as credible, why are we not seeing it as credible? And then philanthropy that's thoughtful. We have now a coalition of maybe 8 donors that are going to be implementing in 3 provinces, giving something like 30 million rand over 3 years. And they will do this increasingly, building on evidence. They're doing it without us. They didn't come to the ministry to ask us to do this. They took our evidence, built their own programs, and I think that's a good thing. So it's sort of learning lessons from the top, making sure they're rigorous enough, staying long enough to fight for your lessons, but having enough of a decentralized implementation so that uptake is sort of happening everywhere without our direct control, and trying to stay apolitical.
Thank you for the cookbook of how to navigate. So we're coming to the end. I'll just also a quick reflection to some of the comments. So one thing I found very counterintuitive when we started scaling a program called Teaching at the Right Level in Botswana is there was this permanent secretary who said, I really want you to start strong. And that actually made us nervous because we said, well, if you start strong, it's very selected. Is that representative? Is that scalable? And there's a few things you can prioritize when you're scaling: highest need, representative, start strong. It's an important choice. And she said, no, as the PS, and she's a very legendary principal secretary, she said, I always start strong, because if you start strong, it's a domino effect. Then the next, you go to a region where it goes well, people see it's gone well, the next region gets inspired, And I was like, oh, okay, scaling is an endogenous process. We should embrace that. I've been trained to be scared of endogeneity and worry about it. But actually, this is a case where embracing it seems to have been a strategy that's worked for this permanent secretary. So I thought that was fascinating. And we ended up doing that, and it's worked much better than the alternative that we don't know because we don't have the counterfactual, but it's worked pretty well. So so thank you, everyone. Great session. We're coming to the end, and I believe we're now shifting to cake, to CSAE 40th celebration. So big thank you to the panel. Round of applause.